In examining key milestones in mental health legislation, we begin with the crucial Mental Health Act of 1959 in the United Kingdom, a transformative piece of legislation that sought to modernize mental health care. This act represented a significant shift from the previously entrenched practice of institutionalization towards a focus on community-based care. By recognizing the rights of individuals with mental illnesses, the Act laid the groundwork for future reforms that would aim to integrate mental health services into public health frameworks. It symbolized a burgeoning understanding and acceptance of mental health issues, reflecting changing societal attitudes toward treatment and care for individuals facing mental health challenges. Turning our attention to the United States, the Community Mental Health Act of 1963 marked a groundbreaking shift in mental health policy. This legislation aimed to provide federal funding for the establishment of community mental health centers, aligning perfectly with the growing deinstitutionalization movement of the era. By promoting outpatient care and community support, the Act aimed to dismantle large psychiatric institutions that often failed to meet the needs of patients. The ramifications of this legislative effort reached far and wide, shaping the structure of mental health services across the country and influencing how communities support individuals grappling with mental health issues, thus improving quality of life. The Americans with Disabilities Act, ADA, of 1990 was a groundbreaking piece of legislation that fundamentally changed the landscape for individuals living with mental health conditions in the United States. This law prohibits discrimination based on disability, including mental health disorders, in key areas such as employment, transportation, and public services. The ADA marked a significant advancement in the recognition of mental health as a disability deserving of equal protection under the law. By promoting equal opportunities and access for individuals with mental health conditions, the ADA has reshaped societal perceptions, advancing the movement towards inclusivity and challenging long-standing stigma associated with mental illness. In 2008, the passage of the Mental Health Parity and Addiction Equity Act was a milestone that addressed disparities in health insurance coverage for mental health services. This legislation requires health insurers to provide equal coverage for mental health and substance use disorders, aligning these services with the standards set for physical health treatment. By mandating parity in insurance benefits, the Act has played a pivotal role in increasing access to crucial mental health services and destigmatizing mental health care. This important legislation reflects a growing acknowledgement that mental health is just as critical to well-being as physical health, paving the way for integrated care systems that serve all aspects of health equally. The 21st Century Cures Act, signed into law in 2016, represents a vital step toward enhancing mental health care delivery across the United States. This act not only aimed to improve access to mental health services but also emphasized the integration of mental health care into primary health settings, recognizing the interconnected nature of physical and mental health. With funding allocated for innovative treatment modalities and evidence-based practices, this legislation reflects a seismic shift in how mental health is perceived within the broader healthcare system. By embracing a holistic approach, the Cures Act signals a commitment to improving health outcomes and acknowledges mental health as an integral part of overall well-being. Despite the numerous legislative advancements, ongoing advocacy remains crucial in addressing mental health issues and ensuring that progress continues. Current advocacy movements emphasize the need to enhance access to care and advocate for policy changes that address systemic inequities, particularly for marginalized communities. Future directions in mental health legislation must align with evolving societal attitudes and the ongoing demand for inclusivity and rights for individuals living with mental health conditions. By continuing to raise awareness and influence policy, advocates can foster lasting change, ensuring that mental health remains a priority on the national legislative agenda and that individuals receive the dignity and care they deserve.